Do I have diabetes? If you're asking yourself this exact question, then we should now talk together about the typical symptoms, because that's where it all begins. What if I have symptoms of diabetes? Is it detected in time? Can it be treated in time? And in some cases, does it even offer the chance of a cure or reversal? I am an endocrinologist, diabetologist, and gastroenterologist, and I have been treating people with diabetes and hormonal disorders for over 25 years. And now, let's get started without further delay. Everything begins with the insidious symptoms, and we will discuss these in the following. In further videos, we will talk about diagnostics, nutrition, medications, and complications. But first, let's talk about the symptoms. Every day, your body sends out desperate SOS signals, but you overlook them day after day. Frequent urination, an unending thirst, unexplained weight loss. Sounds harmless. Wow! These seemingly insignificant signs could be the harbingers of a serious illness. Diabetes mellitus. Ignoring diabetes is playing with your health, often with fatal consequences. In this video, you will learn how to decode your body's encrypted messages so you can act in time. Welcome to Endovision with Dr. Berger, your leading channel for insightful perspectives in the world of endocrinology. Here, we highlight the central challenges of our time: diabetes mellitus, obesity, thyroid disorders, and the essential role of nutrition for a healthy life. Subscribe to Endovision if you are ready to take your health to the next level. Here begins the path to a healthier, self-determined life. Diabetes mellitus. For many, that sounds like an abstract term, something that always affects others. But the truth is, diabetes often develops quietly and silently over the years, while the body has been sending out desperate cries for help for a long time. Some of these signals are loud and urgent, others so subtle but they are easily overlooked. Today, we want to take a closer look together and interpret the messages our bodies are sending, because each individual symptom reveals how hard your metabolism is already fighting. Stay tuned. The information you are about to receive is important for a healthy and long life. One of the first symptoms is frequent urination, polyuria, the silent cry for help from the kidneys. Frequent urination does not seem threatening at first glance. Many think of increased fluid intake or stress. However, in diabetes, the cause lies deeper. If blood sugar levels are too high, the kidneys try to flush the excess sugar out of the body. In the process, not only large amounts of water are lost, but also essential electrolytes like sodium and potassium. The result: dehydration. You might also have to get up more frequently at night to go to the bathroom, a warning signal that is all too often ignored. But the effects are not harmless. Chronic fluid loss promotes headaches, difficulty concentrating, and constant fatigue. So if you suddenly have to go more often than usual, listen to your body. It's clearly telling you, attention, something is not right here. At the same time, there is intense thirst, polydipsia, the desperate attempt to restore balance. Imagine your body is incessantly calling for water because it is already dehydrated in the fight against high blood sugar. With diabetes, this thirst is not only intense, it becomes almost overwhelming. No matter how much you drink, the feeling of thirst persists. This is because your body is desperately trying to compensate for the fluid loss caused by polyuria. If this is ignored, your circulation becomes unstable. Blood circulation becomes less efficient, the cells starve for nutrients, and your overall well-being suffers. Anyone who attributes this thirst to high temperatures or stress risks serious consequences. Chronic dehydration not only strains the kidneys and cardiovascular system, but also weakens the entire organism. If you find yourself drinking an unusually large amount without a clear cause, it's high time to see a doctor. It could be a warning sign of diabetes. Fatigue and exhaustion. Energy in abundance, but unreachable. You sleep enough, but constantly feel worn out. In diabetes, this fatigue has a clear reason. Despite high blood sugar levels, the body cells lack energy because the hormone insulin is not sufficiently available, or does not work properly. The result is, paradoxically, a real energy backlog in the blood, while the cells themselves come up empty. The consequence: persistent exhaustion, which cannot be dispelled by breaks or coffee. Added to this are concentration difficulties and irritability, which heavily burden everyday life. Many affected individuals attribute this to stress or age, overlooking the actual cause. However, consider that this type of fatigue is more than just a temporary slump. It is a warning signal that you should take seriously before your body finally gives out. Vision problems. A look at invisible damage. Vision problems in diabetes can be unpredictable. Sometimes a blurry vision occurs, then it disappears again. The culprit is the highly fluctuating blood sugar levels, which affect the eyelids. Many affected individuals attribute these fluctuations to fatigue or too much screen time. But be careful. Consistently high blood sugar levels increase the risk of serious eye diseases such as diabetic retinopathy, where the small blood vessels in the retina are damaged. If left untreated, this can lead to permanent vision loss. Regular checkups with an ophthalmologist are therefore essential, both for diabetics and for individuals at risk, because the eyes are often the first indicators of a creeping disease. If you want to learn more about the classic signs of diabetes and the right time to see a doctor, feel free to check out my other videos. I have linked them below this video. Unexplained weight loss. A dangerous deception. For many, rapid weight loss initially sounds like a welcome side effect. But with diabetes, it is a warning sign. Since the body cannot utilize the glucose in the blood, it resorts to fat reserves and muscle mass. This emergency program puts a lot of strain on your body. This leads to visible weight loss, which, however, is accompanied by a weakening of the muscles and the immune system. Those who initially celebrate the dropping numbers on the scale often do not realize that the body is in a catabolic state, a kind of emergency situation where important reserves are being burned. If you ignore this condition, you risk malnutrition, susceptibility to infections, and a general decline in performance. If you lose weight for no apparent reason, you should definitely have your metabolism checked by your doctor. Itching and susceptibility to infections when sugar becomes a breeding ground. Do you frequently suffer from itching, skin inflammations, or fungal infections? High blood sugar levels ensure that bacteria and fungi can multiply particularly well, especially in warm and moist body areas like skin folds or the genital area. At the same time, a permanently elevated blood sugar level is toxic for your immune system. It becomes weakened and can no longer effectively fight off invaders. What initially appears to be a harmless skin irritation can quickly lead to a serious inflammation or a persistent fungal infection. If you observe such symptoms in yourself, do not hesitate. Early clarification can prevent worse complications. Numbness or tingling when the nerves are sounding the alarm. Our nerve pathways are highly sensitive and react extremely sensitively to long-term elevated blood sugar levels. The first warning sign of what's called diabetic neuropathy is tingling or numbness in the hands and feet. These issues often creep in and are initially ignored, but if left untreated, they can lead to permanent nerve damage or even amputations. In diabetes, proper nerve function is crucial. So pay attention to these whispering warning signs before a quiet whisper turns into an unmistakable scream. Wound healing issues are an underestimated risk. Wounds that heal slowly are more than just an unpleasant side effect. Diabetes affects circulation and weakens the immune system, two factors that are essential for quick recovery. Even small injuries can escalate into serious infections. If you notice that cuts or scrapes take forever to heal, you should seek medical advice. This warning sign may seem harmless, but it shows that your body is already fighting on multiple fronts. All these symptoms are pieces of a puzzle that can point to a bigger problem. Diabetes is rarely a sudden event. It usually develops over years. Those who recognize their body's signals early can take control and set the course for a healthier future. In the upcoming episodes, we'll explain how you can sustainably improve your health through targeted diagnostics, effective therapy, and a tailored lifestyle. If you like this video, give it a thumbs up, subscribe to my channel, and hit the bell so you don't miss any future episodes. Stay tuned. Your health is worth it.